Chapter 4: The Global Contagion of Misinformation, from Foreign Policy to the 2024 Ballot. Introduction: The Borderless Threat. A virus recognizes no borders. Neither does the misinformation that allows it to spread. This chapter reveals a dangerous feedback loop: how the retreat of American global health leadership creates epidemics abroad, while the simultaneous rise of anti-science rhetoric at home produces policy proposals that would guarantee those epidemics explode into pandemics, crippling our ability to respond both everywhere and here at home. The pandemic feedback loop. As the U.S. retreats from global health leadership, epidemics abroad grow unchecked. Meanwhile, rising anti-science rhetoric at home drives policies that weaken our defenses. These two forces feed into each other, creating a vicious cycle that turns local outbreaks into global pandemics, crippling our ability to respond both overseas and at home. We are actively dismantling our first line of defense and sabotaging the second. This is a story of how political choices in Washington, D.C. lead to body counts in the Democratic Republic of Congo, and how those same choices, now crystallizing into mainstream policy platforms, threaten to bring the devastation home in ways we are already unprepared to handle. Part 1: Collateral Damage. A World Abandoned. The PEPFAR Precedent: How Cuts Abroad Cost Lives Everywhere. The U.S. President's Emergency Plan for AIDS Relief, known as PEPFAR, is arguably the most successful global health program in history. Since 2003, it has saved over 25 million lives. But its impact goes far beyond HIV and AIDS. It built the foundational public health infrastructure: clinics, trained healthcare workers, supply chains, and disease surveillance systems that became the frontline defense against all outbreaks, from Ebola to measles. The gutting of this system began pre-COVID. The Trump administration's attempts to slash PEPFAR funding and its promotion of the Mexico City policy, which barred funding to organizations that even discussed abortion, disrupted these critical networks. The consequences were immediate and lethal. The Measles Crisis in the DRC. When PEPFAR-supported clinics shuttered due to funding instability, vaccination rates plummeted. This created the conditions for a catastrophic measles outbreak that killed over 7,000 children in 2019 to 2020, a death toll that dwarfed that of Ebola in the same period. The World Health Organization directly linked the outbreak to weak vaccination coverage and weak implementation of outbreak response activities. The erosion of global surveillance. These clinics are the canaries in the coal mine. They report unusual disease patterns, allowing for early containment. When they close, the world is blinded to emerging threats. An outbreak in a remote village today can become a pandemic on our doorstep tomorrow. The 2024 threat: institutionalizing neglect. This retreat is not being reversed. It is being proposed as doctrine. Political factions continue to hold PEPFAR funding hostage to domestic political issues, jeopardizing its reauthorization. This isn't just austerity. It is the active dismantling of a global early warning system that protects American national security. Part 2: The Domestic Blueprint. From Fringe Rhetoric to Formal Policy. The same ideology that abandons global health infrastructure is now producing a domestic policy agenda that would replicate that failure here at home. The ideas once confined to anti-vaccine rallies are now central campaign platforms. Policy proposals versus historical data, a comparative analysis. Policy proposal: establish an anti-vax task force to investigate claims that have been disproven. Historical outcome: when official bodies investigate debunked claims, it can increase public skepticism. For example, after the fraudulent 1998 Lancet paper, ongoing scrutiny led UK MMR vaccination rates to fall from 92% to 84%, directly resulting in measles outbreaks. Sources: JAMA, 2017. World Health Organization data. The scientific consensus remains strong and clear. Vaccines are safe. Policy proposal: pivot from mandates to a pure education role, removing requirements for school vaccinations. Historical outcome: mandates are essential for maintaining herd immunity. States with stricter exemption laws achieve higher vaccination rates, while education alone is insufficient in combating misinformation. Source: American Journal of Public Health, 2016. Herd immunity for measles requires approximately 95% vaccination coverage. Policy proposal: promote natural immunity as being better than vaccination. Historical outcome: this is a hazardous approach. A 2021 CDC study discovered that unvaccinated individuals with prior COVID-19 infection were 5.49 times more likely to be reinfected. Source: MMWR, Centers for Disease Control and Prevention, 2021. Relying on natural immunity results in unnecessary deaths and cases of long COVID. Vaccination provides controlled and safe immunity. Contracting disease does not. Policy proposal: defund gain of function and mRNA research. Historical outcome: this research enabled the development of COVID-19 vaccines at unprecedented speed. Stopping these projects would be akin to closing the fire department simply because there hasn't been a fire recently, leaving society vulnerable to future pathogens. Source: Nature Reviews, Immunology, 2021. mRNA. A technology is presently the most flexible and rapid tool for vaccine development. The RFK Jr. effect, a case study in mainstreaming misinformation. Robert F. Kennedy Jr.'s presidential campaign was not a sideshow. It was a blueprint. His proposals are a direct assault on public health infrastructure. Anti-vaccine task forces would weaponize the government to investigate long-debunked science, paralyzing agencies and validating deadly lies. Defunding the CDC's global disease surveillance would complete the work of blinding us to global threats, ensuring we are always caught flat-footed. Dismantling school vaccine requirements would plunge vaccination rates below containment thresholds, guaranteeing the return of measles, mumps, and whooping cough. This is no longer campaign rhetoric. Allies of this movement in Congress are already introducing bills to ban mRNA research and strip public health authorities of their powers. The blueprint is being drafted into law. Part 3. The Converging Storm, a weaker world, a vulnerable America. These two fronts, global retreat and domestic sabotage, are converging to create a perfect storm. 1. A world on fire. Cuts to global health funding allow diseases like measles, polio, and novel pathogens to surge unchecked in other countries. 2. A nation disarmed. Meanwhile, Domestic policies deliberately cripple our surveillance, research, and mitigation tools. 3. The inevitable outcome. A pathogen easily enters a country that has chosen to be vulnerable. It finds a population with waning immunity and a healthcare system stripped of its ability to track, contain, or prevent its spread. The result is a predictable and preventable pandemic catastrophe. We are not just forgetting the lessons of COVID-19, we are systematically unlearning them. Conclusion: a path off the cliff. The war on science has gone from fringe rallies to the halls of power. The collateral damage is already measured in bodies in Africa and rising case counts in America. Fighting back requires restoring and protecting global health funding, fully fund and depoliticize PEPFAR and global health security initiatives. They are our first line of defense. Rejecting anti-science policy. Use historical data to publicly shame and vote against proposals that would knowingly harm public health. Demand evidence-based platforms. Investing in scientific literacy. Mandate media literacy and critical thinking in schools to build a societal immune system against misinformation. The stakes are not abstract. Global eradication of polio hangs in the balance. Childhood measles deaths could double. And when the next pandemic hits, the world's defenses will be weaker than in 2019 because we chose to make them so. The contagion of misinformation has become a pandemic of poor policy, and the only cure is an unwavering commitment to evidence and truth. The story you just heard in this chapter isn't just history, it's a warning. And this warning is not over. The policies, the failures, and the human cost we've documented in unnecessary deaths continue to shape our world right now. If you want to understand what happens next, you need to see the full picture. On this channel, we're not just releasing the audiobook, we're building on it. We'll be diving deeper into the data, tracking the real-world impact of the policies discussed in this book. By subscribing, you're not just getting the next chapter, you're joining a community committed to learning from the past to protect our future. Subscribing is the easiest way to ensure you don't miss a single video. The next chapter drops soon. Here's what you can do right now. Hit the subscribe button. Click that bell icon to get notifications so you know the moment the next chapter is live. Check the links in the description below to get the full ebook on Gumroad and dive deeper at your own pace. The most dangerous lesson we can learn from unnecessary deaths is to look away. Stay informed, stay engaged, and please, subscribe. Thank you for watching and for caring enough to listen.